Have you ever noticed something strange? A surgery that a 55-year-old recovers from in 2 weeks can completely change the life of a 78-year-old forever. Same procedure, same diagnosis, completely different outcome. And here's the part nobody talks about. Sometimes the danger isn't the disease. It's the test that started everything. One scan leads to another. One small abnormality becomes a biopsy. The biopsy becomes a procedure. The procedure causes complications. And suddenly, a healthy person is trapped in a medical nightmare they never needed in the first place. That's called the cascade effect. And after age 70, it becomes far more common than most people realize. So today, we're talking about 5 routine medical checkups. Many experts say older adults should seriously reconsider after 70 or 75, unless there's a specific reason to do them. Now, this video is not anti-doctor, and it's definitely not telling you to ignore symptoms. This is about understanding when a test truly helps, and when it may create more risk than benefit. Because after 70, the goal changes. It's no longer about finding every tiny abnormality. It's about protecting your quality of life, independence, energy, and peace of mind. And before we begin, tell me your name and where you're watching from. I genuinely love reading the comments and seeing where everyone is tuning in from. Checkup number 1, routine colonoscopy. After 75. Let me tell you about Dorothy. Dorothy was 77 years old and had already had 2 completely clean colonoscopies earlier in life. No polyps, no symptoms, no family history of colon cancer. But during a routine visit, her new doctor told her she was due for another one. Dorothy hesitated, but she agreed. The night before the procedure, the colonoscopy prep severely dehydrated her. By morning, she was confused, dizzy, and too weak to stand. Her daughter rushed her to the emergency room before the procedure even happened. Dorothy spent 4 days in the hospital with dangerously low electrolytes and kidney stress. And the heartbreaking part? She never even needed the colonoscopy. The United States Preventive Services Task Force recommends against routine colonoscopy screening for average-risk adults over 75. Why? Because after a certain age, the risks can outweigh the benefits. And those risks are real. Colonoscopies can cause tears in the colon, bleeding, infections, and major complications, especially in older adults. Meanwhile, many colon cancers found in symptom-free seniors grow so slowly, they may never actually affect that person during their lifetime. That distinction matters. Rehook. But wait until you hear what happens with heart testing, because the next routine checkup can send perfectly healthy people into invasive procedures they may never have needed. Before we move on, ask your doctor about less invasive options like FIT tests or stool-based screening if you're low risk. And if you ever notice symptoms like blood in the stool or sudden bowel changes, get evaluated immediately. Now let's move to checkup number 2. Checkup number 2, aggressive cancer. Screening in low-risk adults. Now, let's be careful here. Cancer screening has absolutely saved lives. But after age 75, aggressive screening in low-risk adults can create a major problem called overdiagnosis. That means modern scans detect tiny, slow-growing cancers that may never spread, cause symptoms, or shorten your life. But once the word cancer appears on a report, everything changes. Biopsies, specialists, treatments, fear, even when the cancer itself may never have become dangerous. Take Richard, for example. Richard was 79, active, independent, and still fishing every weekend. Then a routine PSA blood test came back slightly elevated. A biopsy found low-grade prostate cancer. He went through treatment, and within a year, he was dealing with chronic fatigue, urinary problems, and a major decline in quality of life. And according to multiple studies, there's a strong chance that cancer may never have harmed him at all. That's the tragedy of overtreatment. Sometimes, the treatment causes more suffering than the disease itself. Rehook now. Here's where things get even more surprising. The next test sounds incredibly responsible, but it can trigger a chain reaction leading to stents, blood thinners, and lifelong monitoring. Checkup number 3, routine cardiac stress testing. Without symptoms. Imagine this. You're 72. You feel perfectly fine. No chest pain, no shortness of breath. Then your doctor says, let's just do a stress test to make sure your heart is okay. Sounds harmless, right? But stress tests in people without symptoms can have very high false positive rates. That means the test suggests something is wrong even when your heart is actually fine. And once an abnormal result appears, medicine rarely stops there. Now you're sent for cardiac catheterization, an invasive procedure involving tubes threaded into the heart. Then comes another surprise. If doctors find partial blockage, which is common in adults over 70, you may receive a stent. But major studies found that for stable heart disease, stents often do not reduce heart attacks or extend life better than medication and lifestyle changes alone. So a person can go from feeling perfectly healthy to stress test, to catheterization, to stent, to blood thinners, and statistically end up no better off than someone who focused on walking, sleep, blood pressure, cholesterol, and diet. Rehook. And if you think that's surprising, wait until you hear about the bone scan many older adults get every year, followed almost automatically by long-term medication. Checkup number 4, routine bone density scans. With automatic medication. Now, osteoporosis is real. Falls can be devastating in older adults. So this is not about ignoring bone health. It's about questioning the automatic treatment pipeline that often follows a DEXA scan. A scan shows low bone density. Medication is prescribed immediately. And while these medications help some people, long-term use has also been linked to rare but serious complications, including unusual thigh bone fractures and jawbone damage. Meanwhile, the most effective way to prevent fractures often isn't medication at all. It's fall prevention, balance training, strength exercises, tai chi, removing tripping hazards at home, vision checks, vitamin D, and adequate protein. These strategies improve mobility and reduce fall risk without adding medication side effects. That doesn't mean nobody should take osteoporosis medication. Some absolutely should. But automatic lifelong treatment deserves a real conversation first. Checkup number 5, carotid artery, ultrasound screening without symptoms. This is the one almost nobody talks about. A carotid ultrasound checks the arteries in your neck that supply blood to the brain. The idea sounds logical. Find blockage early and prevent stroke later. But many adults over 70 naturally have some narrowing in these arteries without any symptoms at all. And once screening finds blockage, surgery is often recommended. The problem? That surgery itself carries a risk of stroke. In some cases, the procedure can dislodge plaque and cause the very stroke it was meant to prevent. That's why experts generally recommend against routine carotid screening in adults without symptoms. Instead, the better focus is on controlling real stroke risk factors: high blood pressure, smoking, diabetes, irregular heartbeat, physical inactivity. The 5 questions every older adult should ask now. I promised you something practical. So here it is. Whenever a screening test is recommended, ask these 5 questions. What's the false positive rate for people my age? If this finds something, what are the realistic treatment options? What are the risks of those treatments? What happens if we simply monitor this instead? And what non-invasive options work just as well or better? These questions change conversations, and any good doctor will respect you for asking them. Closing. I want to leave you with this. There's a difference between medicine that finds things and medicine that truly helps people live well. After 70, healthcare should focus on protecting your independence, mobility, energy, and quality of life. Sometimes doing less is actually the wiser choice. And sometimes watchful waiting takes more wisdom than ordering another test. You have the right to ask questions. You have the right to understand the risks. And you have the right to make healthcare decisions based on your goals and quality of life, not just a checklist. If this video gave you a new perspective, subscribe and turn on notifications. I make videos every week about healthy aging, longevity, and practical medical insights explained in simple language. And before you go, tell me in the comments, have you or someone you know ever had a routine test lead to something unexpected? Take care of yourselves, and I'll see you in the next video.